Hearing loss is when a patient has difficulty hearing voices or difficulty hearing sounds. Hearing loss is a very common problem and is caused by a number of things, including noise, trauma, medication, and the natural aging process. There are generally two types of hearing loss. One we call sensory neural hearing loss, when there's a problem with the nerve of hearing or the inner ear, and the other is called conductive hearing loss. This is when there's a problem with the ear canal, wax building up, issues with the eardrum, or the little bones of hearing, which are on the other side of the eardrum. In many cases, hearing fades so slowly as the departure goes oftentimes unnoticed. The patient may think that people are mumbling a little bit more, or their spouses need to speak up. In this case, friends and family often suggest to the patient that they should seek a physician and get their hearing checked. Others may have a problem when they ask others to repeat themselves a little bit more frequently, or someone noticed that the TV is a bit louder. But sometimes the patient is too embarrassed to tell their doctor, their friends, or family. A common symptom of hearing loss is ringing in the ears, or tinnitus. This can happen in one or both ears. It can be very slight, where it can be easily ignored, or it can get severe enough to bother the patient when they're trying to get some rest at night. Advanced age is the most common cause of hearing loss. As we age, the chances of having hearing loss increases. Another common cause is loud noises, sometimes called noise-induced hearing loss. In some workplaces, ears are exposed to dangerously loud noises every day. Another cause of hearing loss is medication. These can include antibiotics, chemotherapy drugs, aspirin, and also drugs to treat blood pressure. Certain illnesses such as heart disease, high blood pressure, and diabetes put the patient's ears at risk by interfering with the ear's blood supply. Trauma is another common cause of hearing loss, especially when it involves a skull fracture or a perforation or hole in the eardrum. This put the patient at a serious risk for hearing loss. Another common cause of hearing loss is infection, or even something as simple as earwax that can block the ear canal and reduce the hearing. Hearing loss is diagnosed using simple, in-office physical exam tools like a tuning fork. Then we often refer the patient to our audiologist for a more in-depth hearing test using a special booth. Treatment depends on the type and the source of hearing loss. If your hearing loss is due to sensory neural hearing loss and associated with age, sometimes called presbycusis, then a hearing aid would be most appropriate. On the other hand, if your hearing loss is related to noise, then wearing hearing plugs or hearing protection will be beneficial to prevent further loss, and a hearing aid will be beneficial to enhance your quality of life. Hearing loss due to medication are more complicated, whereas sometimes the hearing loss is reversible when the medication is stopped, or sometimes the damage is very progressive and irreversible, just depending on the drug. When hearing loss is conductive, usually something can be done to give you a hearing boost. Repairing the eardrum or the little bones of hearing. In rare cases of complex ear disease, sometimes a surgical hearing aid may be beneficial. Here at North Oaks, we have several full-time audiologists that can help our patients at both the Hammond and Livingston Parish location. In addition to the standard hearing test, we offer a more detailed test for inner ear and also the nerve of hearing.